Hello viewers, Voice of Nagaland News Etia Zion Hospital de ahigina ase. Cha kali amikhan apniange yate etia Meningococcal laga opore apniange update loigena janai dishe. Kali apniange koi dia nishina itu laga bimar bra ekta suspected 14 years old ekta bacha do iledo itu bra succumb hoigena murishe goina do amikhan apniange janai dishe. Aro achi amikan update luigena janibo pari daga do issue ledo etia CHI sar khamar do itu choichon bacha khan ge kun observation period te rakhigena thaka kan do issue ledo takhan ge release kuri dishuna itu amikan khobor huni ase etia amikan Zion Hospital de itu disease outbreak hoigena thaka laga opore apnian ge update luigena anibo hoigena etia aigena ase aro etia amikan Dr. Akumtoshi Taido hiledo yede pediatrics ase aro ekta child specialist ase. Do viewers kan IB amigan itu laga opode meningococcal laga disease ki ase. Aro actually itu laga disease to hiledo kimman danger ase. Aro itu disease to hiledo kun khani vulnerable ase noisugle do yede itu laga prevention khan kinaka hobo lage. Itu laga opode mohan apnian ge detail report update logina janai dibo.
So hi, my name is Dr. Akum. I'm the pediatrician here in Zion Hospital. Since the media people have come to me, I would just want to briefly tell about this disease that has been flying around in the media. It is an infection caused by a gram-negative cocci, and this bacteria is called Neisseria meningococcus. So this bacteria is not a very common disease, but sometimes there can be outbreaks. I won't say that this is a big outbreak, this is a small outbreak, but just because it's a small outbreak doesn't mean we can't be vigilant. We have to be vigilant, and I'm very happy to the referral hospital who has immediately notified this disease so that all of us are aware. The most common variety that we see in India is the A variety. There are different serotypes, but A variety is one of the most common. I don't know which serotype this will come out. I don't think the final reports are yet out. As I discussed yesterday with my friend, I think it is not yet out, but I think it may be A. There are other serotypes like B, C, W, Y, but let's see what the serotype comes. We do not need to panic at this moment. Yes, we need to be aware of this disease. We need to take the preventive steps, but we should not panic. There are specific treatments for this, and therefore I think without panic, if you have any fever, vomiting, headache which is really bad, you have photophobias, you can't see the light palbra nasai, so matha bishi bikhai, fever hoi jai, vomiting khan bishi kore, noile light khan sa dem de sabo na pare, aru neck khan bishi bikhai, rigid hoi jai. I think these are the times when you really need to go to the hospital and get yourself checked. Yes, so this is not a disease that is present in animals. This is a disease that is present in humans as of now. Surfaces khande na thake. This disease can spread from one person to another, especially mass pindanai aru sneezing kore ase, coughing kore ase, aru ekta manu do khasi kore ase, moita laga osore ase, and that person is affected koile do moido infect hobole chance thake. Utensils khan saliva lagigina thaka share korile, cigarette khan saliva lagigina share korile, kiss khan kora time de saliva spread hoi jaile, itu time de spread hole chance bishi thake. So as I said, moi koa nishna fever is one of the common. Itu logode matha bikha, vomiting khan bishi common ase. All of serious khan do rashes khan olabo, thing heart body khan de rashes khan olabo, red rashes olabo. This can be because of DIC connect the condition thake. Itu time de mokhan la platelet count to body de khai loi, consume hoi jai, aro platelet kom hoa karone petechial rashes khan olai jai, aro rashes khan to bishi hoi jai se gole to purpura hoi jai se gole to itu olop severe hoi jai. Inika hoa time de blood pi loss hoi jai, mokhan bleeding khan bi hoi jai, aro bleeding aro bishi hoi jai se gole to itu shock ti bi jai jai, so hypotension hoi jabo, shock ti jai jabo, itu olop serious hoi jai. So inika serious no ha dem de matha bikhai nole bukhar bishi hoise, light sa dem de sabo na pare, dizziness hoi jai gola dem de to pat lui jabo lage, unconscious khan hoise noile bi petechi khan hoise gole to olop itu to serious hoi jai ase, immediately admit bi koribo lagibo pare.
Sir, can you share us on the prevention and also the cure of the disease?
So the good news is that cure to ase, antibiotics khan bhal ase. etu khan dile to bhal hoi jai. So it's not like COVID that etu bimar to na jane cure na inega la do noy. That's the reason why we don't need to panic. But at the same time prevent koribo parele to bishi bhal bimari noile do. So prevention laga do there are 2-3 things that we can do. One, the vaccination koribo pare. So 9 months pra baby khan do loi gina etu vaccine khan di thake mokhan till 55 years tak lobo pare etu vaccine khan. Aro apart from vaccine, mask khan pindi gina manu laga droplets khan, sneezing khan, cough khan kura time de etu droplets khan mokhan ki nuchoi. Aro saliva khan, cigarette noilis, kiss khan, suspected people khan logot etu khan nukurile do mokhan etu lagi bole chance to bishi kom hoi jai. Aro as I told you, treatment do ase. And suppose apni suspected ekta manu logote in contact aishe, you are not sure tai to ase na nai, ina koile bi dawai kunba khabo pare, etu ki prophylaxis bi koy. So etu khan dawai bi ase. So that's the reason why we don't need to panic. Immediately apni problem hoy ase gole hospital jai na doctor ki log pabo lage. Mostly to itia young people khan ki hoy ase, adolescents, young people khan ki mostly hoy ase. Kitiaba school khan de hoy, colleges khan de hoy. Kitiaba to army noile barracks khan de, police khan inika group thaka khan de olob bishi bak hoy. So yes, Asia de, India de bi hoi thake kitiaba to outbreaks, chutu outbreaks, like February de Shillong de kunba chutu ekta outbreak thakise. Inika chutu outbreak de hoy India de hoile bi endemic hodai hoi thaka to African countries te bishi wala hoy. So there are some places in China, Bangladesh inika bi hoy, hoile bi Nagaland de bishi common noha karone etia olop viral hoi na manu khan olop panic kori ase. But as I told you again, we don't need to panic. It's not in a big outbreak, so we just need to be vigilant and meet our doctors if there's any symptoms.
Sir, you have mentioned that young people are affected. So, like, how can the parents differentiate between this common fever and the viral infection? Can you differentiate?
Yes, so parents can either differentiate korbole to kitiaba to olop diktar bi pai jabo pare. That is the good question, but what you need to know is fever hoise, bacha bura matha bikhai ase, noile vomit kore ase bole to you definitely have to go to the doctor and let them see. Inega korina hai apni to differentiate to doctor bai koribo lagibo. Kile as parents symptoms to na janibo pare, full symptoms to rashes kan olaile to viral rash ase na petiki rash ase na ki la rash ase itu bi na janibo pare, purpuric rash ase na ki ase. So it's definitely better if you go to the doctor and let him diagnose. Ajikali cephalus, third generation cephalosporins kan de ceftriaxone korna ase. So those are very effective. So sabi viral fever hole bi mokhan fever bi hoy, matha bi bikhai na, viral hole bi hobo pare, typhoid hole bi hobo pare. Hole bi one of the most important thing that you should look out is for the headache. Bishi biabra headache hoy ase, vomiting non stop kore, neck khan to stiff hoi jai, neck bending khan koribo na pare, noile bi neck to bishi pain hoi jai, rashes khan bishi olai jai ase, unconscious hoi jai ase, dizziness hoi jai ase, loss of consciousness, seizure khan hoi ase gole definitely seizure, convulsion khan hoa tak to definitely you have to suspect.
Do viewers kan idu daise Dr. Akumtoshi, pediatrics, Zion Hospital aro child specialist. Yade taibra ami kan ge janकारी dia laga insap te apni kan puji lishe guna ami kan itu akha kore ase lebi in addition tai kwa laga opore apni ge information dibo mun jai daga do itu meningococcal laga saigina jaisugle do itu ekta bacteria ba hoy itu bacteria laga naam do ile do Neisseria meningitis koy kita itu meningococcal bra itu laga disease solai sugle do itu kan laga symptoms to ile do ki hobo gole do apni nausea hobo, high fever hobo, noile do neck khan de stiffness, noile do yede skin khan de rashes kan ami khan dikhibo pare. Itu laga opore ami khan apni ge kobo mon jai to jichi apni kan itu jolti identify kurbo pare sugule do apni ge nearest hospital noile do ekta bal doctor physician khan ge visit kurobole janai dia ase ki ane sugule do itu early stage te detect nogusugule do yate fatal hobole bi high chances ase guna itu ami khan honjubo pare ase itu laga opode yate ami khan janibo pare taka do kun hi vulnerable ase aro noisugule do yate kun khan ge high chances itu laga opode infection hobole ase gule do yate especially bacha khan ge infection hole bi high chances ase guna itu bi honya ase. Not only that yate dango manu khan ge holi bi laki bole high chances ase guise yate kun vulnerable khan do isugule do yede immune system kun low ase itu laga opor de lebi itu bacteria do ile do fastly spread hoigina infect hoigina itu apni ange janai dia ase itu laga prevention laga opor de ami khan hunibo pari thaka do ile do itu ekta curable disease ase guina itu ami khan hunia ase itu laga opor de apni khan panic hobole kam nai olebi some few prevention measures kan do apni khan ki kurbo lage gole do yede apni khan kun infected ase itu khan laga hat khan bra apni khan kha lo khan sharing nuguru bole janai dia ase noi shugle do jidi apni crowd te ja ase noi shugle do yede alag jaga de kun phir bishe ase to la jaga de ja shugle do apni khan ge hat khan sanitize kuru bole noile do face se mask laga bole bi janai dia ase kiane shugle do itu virus toile do salivia khan bra hoye sneezing goradam de not only that yede apni khan kha lo de exchange kura utensil khamra lagi jai secret khan kha dam de yede infected manu laka hat pra lui gina khaisu gule do itu apni ge bi laki bole chance ase gunai do ami khan honibo pare ase to viewers kan ami khan akha kodo ki itu laga information loi gina a khamra apni khan yede panic noe gina paratak to itu information doile do apni khan buchi gina yede chiti enaga laga symptoms ola ase apni khan la bacha ge noi suglu do apni an ge enaga apni khan dikhibo pare ase gule do nearest hospital de apni an ge itu cholti treatment lobole janai dia ase do viewers kan achi laga update enaga daise enaga alag alag update pawole apni kan sai de gibi voice of Nagaland news mui reporter Chris Nguli reporting from Dimapur.